Now, next up, we have Tim Spector. He's Professor of Epidemiology at King's College London, and is ranked on the top 100 in the world's most cited scientists. His current work focuses on the microbiome in nutrition, and he's the author of 4 popular science books, including The Diet Myth and, more recently, Spoon-Fed. He's also the co-founder of the data science company ZOE, which has commercialized a home kit for personalized nutrition, and he is the lead researcher behind the world's largest citizen science health project, the ZOE Covid Study of over 4 million people. Please welcome here with us here in the studio, Tim Spector. Tim.
Hello there. Thanks very much. And I wanted to talk to you today just very briefly about the work that I've been doing. And really this has stemmed from my work for the last 25 years on twins. And we have 15,000 twins that we've been studying for all over the country, a fascinating natural experiment looking at nature v nurture. And most of that time was looking at how similar and identical twins were to each other because they are natural clones. But in the last decade or so, I've got more interested in why identical twins are often different for different diseases, and why one develops cancer, the other one doesn't. One gets depression, the other is happy, one is overweight, the other is skinny. And exploring not only things like epigenetics, but more recently this got me into the gut microbiome, because the gut microbiomes of twins are actually very different. And this led me to really explore the whole of nutrition differently and brought me into this whole field of personalized nutrition. And I was giving a talk about my book, The Diet Myth, 5 years ago in London, when 2 internet entrepreneurs who've been working on those algorithms for adverts that follow you around when you don't want them, and they came to me after my talk saying we'd love to form a company to personalize nutrition using the microbiome and other new methodologies. And I initially said, well, I'm not interested unless you're really going to fund research. So you've got to go and find a few $1 million to go and get this to do it properly. It's not just going to be marketing. And amazingly, they did find the money and came back, and the company ZOE was born. And this was Jonathan and George. And the interesting thing is that it was just exactly the right timing, because the whole big data scene was on us. AI was now possible to crunch these big numbers in real time. And we also had the CGM, these continuous glucose monitors, the amazing invention that I've got one on my arm now that gives you a reading for 2 weeks of your blood sugar that you can read on your phone. We've got new technologies for doing blood spots that are able to look at hundreds of metabolites in your blood just from home. Obviously, mobile phone apps have come on hugely, and now for nutrition they're fantastic because you can actually record what foods you're eating, you can log them, you can use barcodes, you can take photos, you can also log your mood and your appetite as you're going along in real time. And then finally, the last piece of the puzzle was we could actually, using genetic methods, measure all the microbes in our guts, at least 80% of them, really with great accuracy at a price that has fallen tenfold in the last 6 years. So all these ideas were in place to have suddenly an accessible home product and a company that could do that if it did the science. And that really led to getting ZOE together, which was very much an academic collaboration across the world with the company as the basis of it, who was funding it and driving it. And we had a very multidisciplinary team in machine learning, microbiome, metabolomics, nutritional science, and we had the best scientists from Stanford, Mass General, Harvard, King's, Tufts, etc., working with us because everyone wanted to look at this unique data. And the key was to this that we were actually setting up a unique study that hadn't been done before. Now, while that study was just wrapping up, COVID hit. And so I was cycling home in London as we were all being locked down, all the studies were shutting down, and we came up with the idea of converting the nutrition app and the whole team behind it to doing something about COVID. And this exciting project meant that we actually managed to build an app in 5 days and launch it on the first day of lockdown in the UK. And this app exceeded all our expectations. Within 24 hours, we had 1 million downloads, and it crashed our server. And within 2 weeks, we had 2 million, and eventually got up to 4.5 million users. And we still have 1 million daily loggers even now, 18 months on. And this was because we were filling an unmet need. People weren't able to see their doctors. They weren't able to get to hospitals. They were told to just shut up and go away. No one was listening to them. We listened to them. We took all their symptoms and we converted those symptoms into predictive algorithms about saying whether they were likely to have had COVID or not, put that on maps around the country. And also, we've now generated so much data. We have nearly over 350 million health reports now. And we're the only app, as far as I know, that is around the world that's able to give incidence data in real time every day in different areas of the country. And so this has been real breakthroughs. We've written over 20 papers in the top journals and contributed many new symptoms to the world's list, such as loss of smell and taste, delirium in the elderly, skin rashes, COVID toes, etc., etc. And we're trying to looking at the new symptoms there are today, which are cold-like symptoms, which need to be looked at. So that app has now evolved into we've got ethics to go beyond COVID and are reconsenting hopefully 1 million people to convert to a long-term look at other common disease like cancer, dementia, and heart disease. So this could have an amazing longevity as the largest survey of its kind in the world. Now, coming back to the original aim of ZOE, which was to get a commercial kit that people could use at home. This is the basis, which is a simplified version of what we did in the hospital, which is basically a series of starter tests where you take identical foods like muffins, take blood tests, put a CGM on, look at the microbiome, and then you ask people to log their foods for 2 weeks afterwards, and giving masses of data. But the key finding we found, the sort of aha moment for me, was when we first looked at those results, the incredible variation that normal people had to eating an identical muffin. And we saw an 8 to 10-fold difference between normal people responding to that muffin, both in terms of their sugar insulin, but also their fat responses. And that meant we had the basis for a big variation to do prediction algorithms so that we could then see how they're going. The other sort of our point was that the twins, who were the majority of the people in the study, showed us that genetics were not that important. And there are many companies now trying to sell genetic products for nutrition, but our study showed that we saw major differences between identical twins in their response to food. Now, we then went on to look at microbes, and this study in great detail looked at the foods people eat, the microbes that affected, and the health outcomes those microbes were associated with. And strangely enough, this is the first study that's looked at all 3 of those processes. And we published this in Nature Medicine and found really that everyone has 15 good and 15 bad microbes that we can identify that are associated with both certain specific foods, so we can give advice on those foods, and health outcomes like body weight, heart disease, blood pressure, blood lipids, diabetes predisposition, etc. So we're able to do that. Now, the advice we give is all based on the concept that we want to reduce these stresses to the body. So as I showed you, those muffins give stress because of the peaks that they produce, both in sugar just after the muffin and also at 6 hours in terms of fat levels. People who have those high levels have more stress long term. So we wanted to reduce that in order to reduce weight gain and many other inflammatory related diseases, including diabetes, heart disease, etc. So flattening those curves is really important. These are my results. They're pretty dreadful in terms of my blood sugar control, my blood fat control. The only thing perhaps holding me together is my microbiome, which is in the top 5% of the population, which is just as well because I've written books on it. And I got given my own results in the app, which basically rank all the foods for me rather than the traditional way, just based on calories and fat. And I also got an interesting result that I had a parasite in me that 30% of British people do and 10% of Americans, which strangely is good for me and perhaps keeps me thinner than I would otherwise be. So we're looking at ways of seeing how can we grow up some of these parasites that we didn't expect to be healthy. And this is what the new technology is showing us, many more exciting discoveries. Now, the ZOE program is now live in the US and will be coming to the UK in the new year. And basically, you do the test at home, you get the insights, you then go on a 12-week program with the help of nutritionists through a text trainer and coach to get you there, and then you can retest and obviously get updates. And the key is that you are trying to balance people's individual metabolic responses to their choice of foods. And so you can build menus based on these scores, which are not at all the traditional way of looking at it. They do not mention calories. We don't mention percentage fat. It's all about this blend of these three items, the effect of sugar, fat, and being good for your microbiome. And long term, this is sustainable. The outcomes we've had so far have been very exciting, with people who followed their personalized ZOE plan after 3 months experienced 9.5 pounds average weight loss, and 83% generally felt less hunger, and importantly, 82% had more energy, and we hadn't expected that as a major finding. And the nice thing about this is that everybody who takes the commercial test is actually signing up to do more studies. So we are generating more data all the time. That data gets shared and improves our algorithm so that we can delve deeper into the precise meals and complex meal patterns together to give people even better advice. And it's continually updated as we get more and more data and get towards 1 million people, where our degree of refinement about every food should be excellent. So to summarize, really, this is about transformation, not evolution. But I think healthcare is being transformed by this method, which of interaction, particularly as we've seen with the nutrition app, but also with the COVID app, the fact that you collect data and people are very happy to give it if they're also getting feedback. And this allows this continuous pattern to go along. So I think health apps and personalized nutrition are absolutely the future. And if you want to learn more, you can read my books or go onto the ZOE website. Thank you very much. I'll take some questions.
Thank you, Tim. I'll definitely download the apps. I've read the books. Before we go into audience questions, I do have a question for you specifically regarding the COVID study. Did the UK government ever get in touch?
In the initial months, it was totally funded as a pro bono thing by ZOE for the first 6 months, and no one from the UK government contacted us other than indirectly tried to shut us down.
Interesting.
Because we were seen as a threat to the NHS X app, which, as you might remember, was promising to deliver a comprehensive symptom track and trace idea. So there was a lot of resistance from institutions to what we were doing, despite the enormous appeal to the public. So in a way, there was a disparity there. People in institutions were worried that they weren't controlling this, and also that it was a private company doing it as well, I think. It wasn't a government-initiated plan, and that's why there was a lot of resistance. Eventually, that did change. We got the support of the Chief Scientific Officer, Sir Patrick Vallance, was really behind this from the start, and slowly managed to convince the other groups, so that by the summer, we had some support from the Department of Health, who brought it into their portfolio of tests, and so we were getting at least short-term funding from the Department of Health. So things did change, but they were a pretty dodgy first few months.
I'm glad they changed their mind. Audience questions. So do you think apps like ZOE could potentially help transform the traditional ways we access healthcare in the future?
Absolutely. I think we've shown that if you engage with people in a two-way platform, as we've done with the ZOE COVID app, giving people back their results and what's happening in their local area, they will engage, and it could really change the way we do preventive medicine. It could really reduce the need for GPs. We could have a triage service. I think we've shown the way for a minute fraction of the cost of traditional healthcare. This is something. So, and as I said, we've expanded this from COVID now to all healthcare systems. So we are able to, in fact, run pilots on a massive scale to see how people are engaging. And we asked people on the app what were the major diseases they were concerned with, and they gave us the answer. It's cancer, it's dementia, it's heart disease, it's joint pains, and it's mental health. They were the top 5, and that's what we're going to try and look at. And I think things look at preventively, can by tracking your health on an app give you an early warning device about what's going on if you use algorithms to put it all together. And so catching things much earlier than is currently the case. So I think it's enormous potential in all domains.
Do you believe that we all should be eating a plant-based diet to reduce the risks of early onset diseases?
Definitely. Any diet that improves your gut microbes is going to be good for your health. And at the moment, predominantly plant-based diets, avoiding ultra-processed foods, including fermented foods, and at least 30 different plants a week is the ideal diet as far as we know at the moment. So you can eat whatever else you like, but as long as you get your 30 plants.
30.
Which can be nuts and seeds and herbs. So there's little tricks around it. It's not as hard as it seems.
So 30 a week then?
30 a week,
rather than 5 a day.
just gets lots of mixed nuts and seeds, and think variety and diversity. It's not about eating the same healthy food every day. All about your gut is about diversity.
Great advice. Thank you so much, Tim, once again. Thank you for being here.